Hi. So I'm going to be talking about mercy killing and euthanasia, or euthanasia, and whether it's right or wrong, or moral and or immoral. And a little bit about mercy killing and euthanasia is that the practice is legal in the United States, but very few states allow it or legalize it. And outside of the United States, there are very few countries that do allow euthanasia and mercy killing. But other than that, it's illegal. So I am for euthanasia and mercy killing just because I would like the opportunity in the future to have a means out of suffering and pain if I were to be in pain. And I also want to have other people to have that opportunity as well. So, honestly, I think it's unethical to keep someone suffering when you have an opportunity like this to give them medicine so they are not in pain or they're not suffering, just because they have dignity when they die, when they wouldn't have that if they were in a state that doesn't have legal euthanasia, and they would have to be prolonging their death, and there's no way of just keeping them comfortable. So also, it's kind of hand in hand with a DNR. If you don't know what a DNR is a do not resuscitate form, and it means if you are having a heart attack or a stroke or something, a doctor cannot resuscitate, they cannot help you medically, they cannot try to bring you back to life. And I think that's more of after the fact, or maybe too little too late per se, just because if you are dying and you have a few months to live, I don't think it's right that you have to sit there and wait for your death, and then along that journey you have heart attacks and strokes and you're just in pain and suffering. That is not right. I don't think that's right. I think that's unfair. So I think euthanasia or a mercy kill can prevent all of that suffering. And also trying to keep that person who is dying, who has that terminal illness, is so expensive. There's so much money into it. It's thousands and thousands of dollars. And medicine for a mercy kill probably costs $200. So it wouldn't financially put a burden on that family. But the opposing side does have a very strong argument. It is murder. In their eyes, it's not right to take a life, and that's very true. No one does have the right to do that. There's no schooling for euthanasia. There's no certificates, no degrees. So if it were to happen, or like if you were to go somewhere and want to be euthanized, you don't know if they're properly trained or anything like that. And then you have suicidal or other kind of opportunists to take advantage of the system or abuse it, and that is very dangerous, and it can lead to lots and lots of malpractice issues, and it would just be a whole mess. And that's a very strong reason as to why it's not legal, and I can't blame them, just because you can hurt innocent people in the process. So that's why a lot of states have a lot of rules and regulations, and they also have a lot of protection for these doctors and practitioners. And a good one is that they have immunity for these attendings and these physicians and doctors and practitioners, and they're not liable in any sort of way. There are no disciplinary actions just because they are acting in good faith. They are granting that patient's wish, and I don't think any doctor can deny a patient's wish. And it kind of just, it gives this this patient a sense of responsibility. So doctors and practitioners are not responsible for their death because it's an assisted suicide. And they're just aiding or helping a patient with their passing. So even though there are rules and regulations and there are protections and there are all these great outlines, it does raise a lot of questions. And these are probably questions a lot of states had to answer before they could legalize it. And they're great questions. They're difficult questions to answer. And it's like a great one is how to prevent miscommunication between doctor and patient. Also, how to make sure that if you do legalize it, how do you prevent or minimize consequences or mistakes because you're dealing with someone's life. You have someone's life in your hands. Because that ties into the question of how do you ensure it's done properly? How do you make sure that you administer this medicine for someone who's terminally ill and then they wake up but they're brain dead? So it's just a lot to think about. There's a lot of questions, and Oregon has addressed a lot of these in a very fashionable, very appropriate, and very professional manner. So these are requirements. So this is a form that you have to fill out, and you have to make sure that when you fill this out, you are right of mind, you are sane. You have to have a lot of signatures, you have to have a lot of IDs, you have to have witnesses. You need to make sure that you have everything set up before you get this form. You also have to go through counseling just because you need to make sure that you know and understand what you are doing. So, some more on Oregon is that you need to be 6 months into, you need to have 6 months left into your terminal illness. And just because they want to make sure that you're not a healthy patient, and you do have other means of being healthy and getting rid of whatever illness or sickness, cancer, disease you have. Some other things that they have in place, some more rules and regulations, is, well, this is for more so protection and for the public, is that the public should not take it upon themselves to perform that. So it prevents accidents and opportunists, and it makes sure that someone who's laying on the side of the road doesn't get shot just because they look like they're dying or something. So overall, I think it's a great idea. I think it's a great means to an end, and it can really help a lot of people who really just want to go and want to leave this world peacefully.